very good morning. I am Dr. Balaji Saibaba. I am a consultant orthopedic surgeon. So today we will share some of the common questions which patients who are undergoing or willing to undergo total knee replacement ask the doctors about. Okay, let's get started.
Hello, doctor. My mom is 65 years old. Is total knee replacement surgery safe for her?
Yes, age is just a number. What matters is surgical fitness. As long as she is medically fit for surgery, we can very well take her for total knee replacement. This is the most common question which any patient any elderly patient who undergoes total knee replacement asks. So, in general, osteoarthritis is a disease of the elderly. It is an age-related wear and tear process. So, invariably, most of the patients who undergo total knee replacement are elderly patients. So, they may not worry about their age being 60 or 70. So, as long as the medical fitness allows, he or she can very well undergo total knee replacement.
Will she be able to walk independently after the surgery?
Yes, she will be able to walk independently after the surgery. Initially, after the surgery, she might be using a walking aid or a walker along with a knee brace. After a course of physiotherapy and adequate exercises, she will be able to walk independently without a walker.
What is the recovery time after the surgery and when will she be able to cook?
So usually suture removal will be after 2 weeks and recovery time as in for cooking or any other mild moderate activities at around 3 to 4 weeks time she will be able to do the household work.
Will she be able to sit on the floor by herself after the surgery?
Once in a while we can allow the patient to sit on the floor, say 3 months after the surgery, provided she does the physiotherapy and rehab properly. In general, we ask the patients to avoid to do certain activities like sit on the floor, sit in low-lying chairs or sofas, sit in a cross-leg position, squat or kneel down. These positions will increase the intra-articular pressure and will cause excessive strain on the implants. That's why we generally ask the patients to avoid this position. Having said that, once in a while we can allow the patient to do these activities but not on a regular basis.
Can she get both the knees operated at the same time?
Yes, again it's a matter of surgical fitness. If the patient's body allows her to undergo a relatively longer surgery, she can very well undergo both the knee replacements at the same time. If not, we can do a stage surgery. That is, she can get the more painful knee operated first, followed by the other knee as early as 2 days or 4 days, or we can plan any time after that also.
How long is the surgery duration usually?
Usually the surgical duration is around 90 minutes. So for a primary total knee replacement, in case of revision total knee replacement, the surgical duration might be a bit longer.
How long do we have to stay in the hospital after the knee replacement surgery?
In general, we ask the patients to stay in the hospital for at least 3 to 4 days. As in, one day before the surgery, we admit the patient for pre-operative evaluation. The next day, we plan the surgery. And the day one after the surgery, we generally ask the patient to do some exercises, physiotherapy. We mobilize them under supervision with a walking aid. And on day two, we change the dressing and we remove the drain if any, and we generally plan for discharge on the day 2 after the surgery.
Can she take bath after the surgery?
Yes, generally taking bath after surgery is delayed till suture removal. Since we have an implant inside the body, we don't want any risk of infection. So in general, 14 days after the surgery will be the suture removal, and on the 15th or the 16th day, she can very well take bath with soap and water.
So, what are the common issues after a knee replacement surgery?
In general, the most common issues are pain and stiffness. So, as long as the patient is in hospital, we will give her the best possible analgesics which is suited for her age and for her body status. And we will take care of local measures like icing the area, giving compression bandages, applying knee braces, and using a walking aid for walker. So, with adequate physiotherapy and medicines, both the issues of pain and stiffness will be taken care of.
Can she climb stairs by herself post surgery?
Yes, right from day 2 after the surgery, she will be able to climb stairs. Initially, with the help of a knee brace and a walking aid support. And later on, once she is able to do all the exercises by herself, once the rehab is complete, she will be able to climb stairs without support, say approximately around 4 weeks time.
So, what are the precautions to be followed after a knee replacement surgery?
So, in general, the early precautions or the immediate post-op precautions include not to wet or soil the area where the surgery is done. The bandage should not be soiled or soaked. She must do the exercises regularly as taught by the physiotherapist, and she must take care of the diet. She has to have high protein and high fiber diet. She has to have very good hydration. In general, patients who are bedridden will try to avoid taking a lot of water because they don't want to trouble the attenders for using the washroom or using a bed fan. So, in general, we have to take care of the diet with adequate fiber and a lot of fluid intake. If the patient is a diabetic patient, she must take care of her sugars. The sugars should not spike after the surgery. In that case, there is always a risk of infection and knee joint stiffness. So, sugar patients should, apart from following the diabetic diet and taking the sugar medicines, should be very careful about their glycemic control.
So, what is the lifespan of a knee replacement surgery?
In general, a properly done total knee replacement will last for somewhere around 20 to 25 years. And even after that, most patients won't need a revision total knee replacement. Only in selected cases, in selected conditions, patients might require a revision total knee replacement. With advances in technologies and the surgical techniques, even revision total knee replacement is not